First of all, I'm really grateful to be here. As a nurse in the room, we've heard a lot of really important stuff this morning, and I keep honing in on the healing. Wanda and I were talking this morning, and thank you, Wanda. We were talking about the poor birth outcomes that we see for African American and women of color, and she says, well, what are we going to do about this? And I said, we got to double down on wellness, and we got to double down on mindfulness. We got to double down on healing. And so I'm going to ask this entire room, we're going to take some healing breaths, because I think I know I need it, and I don't know if you do. So we're all going to stand up, and we're going to breathe like our lives matter, okay? Inhale in. Exhale. Big inhale. Exhale. Big inhale. And exhale. Thank you. And thank you for the people who went to the bathroom. I know folks need bio breaks. Please come and go as you need to. Because the nurse in me is really needing everybody to take care of themselves. So please, don't be mad if you need to do that. So Mark Benioff is the CEO and chairman of Salesforce, and he is a well-known businessman in San Francisco. And he has led the business charge to boycott North Carolina, particularly around HB2. And our mayor, Mayor Ed Lee, banned travel to come to North Carolina. But when I told them that Anna Julia Cooper was calling people to come together for an intersectional research agenda where it was really going to be centered around women and girls of color, I told them we needed to be here. And so it's amazing, my journey to have come here. When I got funded to develop a community-based free doula training for low-income and previously and currently incarcerated women, I never knew that would put me in a room that would have my expertise ask, how should we spend a $100 million gift from Lynn and Mark Benioff and from Bill and Melinda Gates to really turn the tide on preterm birth? And so I told them, we're not supposed to figure that out, but the people who are at highest risk for prematurity, i.e. women of color, should be the people to tell us how to do that. So I'm going to share you a couple slides with you about how we did that, and perhaps maybe teach a method that we can use as we do our work moving forward. And Melissa, I want to thank you so much for your work, and I do want to be one of the first people to accept your great gift around being an IRA and to help develop that research agenda, because I think it's super important that we do this in partnership, and I think it's super important we center this in the work and in the words and the voices of the women who have to manage these poor birth outcomes. I'm not sure how to advance the slides, so can somebody help me? I don't have any disclosures. The Preterm Birth Initiative has been a very interesting thing. UCSF is the White House partner on the Cancer Moonshot, as we saw a couple weeks ago, where $1 billion are going to be invested in understanding the cures to cancer. We also are the primary partner on the Precision Health Initiative, which we will be hosting a meeting with the White House June 6th and 7th to talk about how can we be able to really have a cells to society approach to improve the health of the United States citizens. We have been planning for 1.5 years at UCSF to really understand how to turn the needle on preterm birth, and we've decided to center our efforts on really understanding toxic stress, particularly toxic stress as experienced by women of color during pregnancy that is geared from both poverty and stress from racism and experiences of discrimination. Part of what we just heard in the last panel about not being heard, I'm going to show you some data about how there are things that we specifically need to do within the healthcare delivery system to be able to improve women's voices being able to be heard. But we really knew that in order to do this project, we had to partner with patients, right? I mean, we really needed to be methodical and strategic in understanding what we were doing. Because initially, everybody thought, oh, $100 million isn't a lot of money, especially when you're talking about bench research and discovery science. But what we really told them was that was not going to be the end-all, be-all in order for us to be able to figure this out. Prematurity and babies being born too early is a complex medical, social, demographic, geography, environmental problem that requires many, many minds, and particularly not just clinical medicine, but also public health, of nursing, law, social work, environmental justice, reproductive justice, and a whole variety of other approaches that will help us to be able to figure this out. And by the way, we want to do this in 5 years. So I want to get back to the method, okay? The James Lind Alliance method was developed in the UK, and originally we had to modify this because in the UK, they brought forward patients, advocacy groups, funders, clinicians, and public policy folks. And it really became apparent and obvious that the voices of the women who experienced prematurity in the UK were really, really drowned out. Right? I mean, you got enough money, you want to throw enough money at something, the funders are going to be the people who are actually heard the most. But we really wanted to modify this method, so we didn't ask all 5 of those groups to come to our sessions. We only asked the women. We have long-standing programs in the Bay Area, and 2 of whom I love dearly, the first of which is Black Infant Health, and the second is the Homeless Prenatal Program. We brought together 14 women to come together for 2 focus groups of 2 hours each. We had childcare, transportation, food. They could bring their friends, they could bring their partners to really be able to talk about what was important to them. If they had the $100 million from the Benioffs and the Gates, how would they be able to spend it, and what were their main priorities? In our first session, we asked them to introduce themselves and to tell us about their family, okay? And in that, we got stories about their healthcare seeking experiences, the disrespect and the lack of being believed during their healthcare seeking experiences. They talked about discoordinated care. They told us about the blatant racism that they experienced and the dysfunction of our existing healthcare system. But they also told us about their children. They told us some very, very depressing stories about how they just wanted people to be able to believe in them and to believe that they could birth their babies. And people were not listening to them. They told us a variety of pieces of data. Let me show you a little bit of it. Okay. In the first meeting, we just wanted them to generate research questions. In the second meeting, we wanted them to rank and prioritize them. So at the end of this presentation, I will show you the top 10 research priorities of women at risk for prematurity in San Francisco. And then I'm going to tell you how we use those priorities, not only to be able to map out the first grants that we were going to be able to provide around prematurity, but now they are informing the entire $100 million initiative. This is myself and my boss, my faculty mentor, Dr. Linda Frank. I want to bring her into the room because she has done amazing work in the UK, improving birth outcomes for children in the first 1,000 days of life. And she is leading our postnatal work to really transform the neonatal intensive care units in this country. The women that we worked with came up with 103 potentially researchable questions, okay? I'm not even going to go through the whole list. I'll show you what they were in groups. Okay? And they had a competition because Black Infant Health had more questions than Homeless Prenatal. But because there was so much overlap, we decided that we could collapse those questions all together and be able to have 103 potentially researchable questions from the community. Okay? There were 25 questions that they brought forward and prioritized, but we have really good evidence for those questions. And so we made a commitment to look up those answers, to be able to develop a brochure and a website to be able to provide those answers to them. And then as we continue to partner together to generate more research questions, that we would add those to the list as we collected evidence to be able to answer them. Let me give you a sense of what they told us. Not sure if you can see this in the back, but the bulk of the questions came from care provision during the prenatal period and birth. 28 of the questions, almost a quarter of them. Some of them centered around infant nutrition and feeding. There were many workplace and insurance issues. There were issues around postpartum care, education and empowerment of birthing women. I spend a lot of my time with the birthing collective, Black Women Birthing Justice, which is led by Dr. Chineri Opira at Mills College in Oakland. And this is so consistently mapping on the work that they've been doing around their land-breaking report that's going to be coming out around the 100 birth stories they collected in Los Angeles called Battling Over Birth, where they're really going to try and get back to traditional practices like having doulas and midwives and granny midwives who reflect the community to be able to improve those birth outcomes. In the second session, the ladies were quite able to be able to not only rank, but also prioritize and tell us exactly what their research questions were that they wanted to focus our initiative on. And at the top, you see, how does mom's stress affect the baby? Right? So when you go back to your original research or proposal or slide, why is our research initiative now centered on toxic stress, and particularly stress that comes from the experiences of racism and discrimination? Is because the women told us that. Okay? You'll also notice things on here like what causes SIDS, what workplace supports are effective to prevent preterm birth. You'll see number 8 around the birth plans. You know that is consistently inconsistent with how medical care is currently delivered, right? Why can't birth plans and reproductive life plans be respected, right? So what do we do with this? Well, right now we're replicating this work in Oakland, and we're replicating the work in Fresno to be able to keep hearing from the community. How can we be able to tailor our program and our project to be successful? So what we did, we put out RFPs, requests for proposals, to give out $2 million of the $100 million for investigators all over the Bay Area, investigators all over California to help work with prematurity. Our community reviewers came and reviewed the proposals side by side with the blind scientific review that's currently happening. So that when we give out those funds, you have to be appropriately ranked with the community reviewers in addition to the scientific reviewers, or you're not going to get any money. So we really feel like, and it was really hard to get the scientists, right? I mean, UCSF is one of the top research universities in the country, right? So it was really interesting to have our basic scientists be sitting with our community women and say, we're not going to fund that because that's not on this list, okay? Okay? Because community expertise matters, and we have convinced our funders that really getting the voices of the community into this process will make us be successful. We don't have to come up with every, discovery around prematurity. Why? Because the community that we're working with will help us understand what those interventions are that we need to be able to develop. One of the big things me and my team are doing is we're going to develop postpartum doula programs and have community-based doula support. As you know, in San Francisco, we are lucky enough that they've just extended paid maternity leave to 12 weeks. Well, we would like to see that all over California. Why? Because we have Leonard Martin Bidioff's fabulous gift, and we have Bill and Melinda Gates' fabulous gift to leverage to be able to make that available to all parents, right? And not just the ones in the liberal Bay Area. I will also tell you that the voices of every individual, every woman that we ask to provide us feedback, and we've been engaging with them quarterly around this initiative. And my goal is if we do not hire at least 25% of the people that we've served and worked with a $100 million gift, then we haven't done our job. And as the person who is responsible for building a community-engaged platform around prematurity and community-engaged research around prematurity, I pledge in front of all of you that if we have not hired at least 25% of the individuals that we've been serving and working with, then the initiative has failed and we have not done our job. The logo that you're seeing, one of the other really exciting things that we're going to be doing as part of this initiative is we are going to launch one of the largest prospective studies looking at stress, resilience, and coping at 10 time points across pregnancy and following children out to 2 years of life. Because we don't just think it's about stress, right? We've got to be capturing resilience. We've got to be capturing coping. And we're going to be adding a biological component to all of this under the Precision Partnership with the White House. So stay tuned because this initiative is going to be launching in 2017. And with that, I'll have questions from the audience, please.
Hi, everybody. I'm Neela Maria from UCLA. I'm really very excited to hear this presentation. I'm wondering if you're doing anything to kind of write up the research methodology so we can actually get it into IRBs and we can kind of change the way that this kind of practice really gets accepted. Because I think that community participation is just really hard to just get through your IRB.
Yeah. So our paper got rejected from the American Journal of Public Health. And part of it is because we did say we're going to replicate this work in Oakland and in Fresno, which are the key geographies in California where we're doing this work because they have the highest rates of preterm birth. Right? And so because we let the journal know, they were like, well, where's the Oakland and Fresno data? So it's coming. But our second paper is actually going out this week, and it's entitled The Healthcare Seeking Experiences of Women of Color at High Risk for Prematurity. That really gets at some of this disrespect, some of this toxic racism, some of the pieces that the structural healthcare environment can actually be making for ourselves. That paper is going to be going out this week, and hopefully will not have any rejections. Our focus groups in Oakland begin before Labor Day, and our focus groups in Fresno will begin shortly after the 4th of July.
Add on to that. So I think in there are a couple of different journals that have been talking about really publishing the actual methodology with like focus group questions and actually putting out a publication specifically on the methodology. And I think I know that I've benefited from when scholars are willing to do that. And so I'm hoping that maybe you would consider that as well.
Absolutely. And our focus group guide will be available as well. For people who want the original Lind methodology, they have an open source website in the UK, and all of their materials are available. But there was a paper by ULM and colleagues in 2015 in the journal Pediatrics that will walk you through the original methodology. But again, we took out stakeholders, advocacy organizations, and clinicians because we really felt like the voices of the women got drowned out. Right, and so I'm happy to share my interview guide with you and with the organizers of the conference so that we all have it and a detailed description of the method. Make sense? Okay.
Hi, my name is Kalisha Petty from North Carolina A&T State University. First of all, I apologize for HB2. I'm embarrassed. I'm so sorry. But when you were talking about being just the doula training and everything else that you were saying, it just reminded me and connected to what they were talking about the last panel about pregnant students. And so I kind of wrote down, jotting a few things down, and I was thinking about at A&T if there are any services like that. I'm pretty sure that we don't have any. And I wrote down if I were to think about getting training. I'm a mother of 4. I just recently was told that that's something I should look into. So I was just thinking about that, and then I wrote offer services to pregnant students, and I realized, oh, that was me. Sometimes I forget. I actually took a year off after I got pregnant with my son, just because there was no support. I was told I was going to lose my scholarship and those kinds of things. So I was just wondering, have you come across any college campuses that offer services like that? And if they do, could you tell us about it and how, if I wanted to start an initiative like that, how I could get started? Thank you.
Absolutely. So I don't know of any colleges, but I will tell you there's a program called Hatch, HATC. They're out of Oakland. They're doing teen-based, high school-based teen and adolescent parenting and pregnancy program doula trainings with pregnant and parenting adolescents who are in high school. And it's just a really amazing program. There's another program called the Teen and Adolescent Pregnancy Parenting Program called TAP. That also is out of San Francisco, and they have a full curriculum. Both are available on their websites. And just to be clear, doula training is something that you can seek. There are a lot of good doula groups here in North Carolina, and you get a twofer, right? Because we paid our doulas to support low-income women, and we paid our doulas to support people in the jails, right? And so it was a dual model of empowerment, but there are several really, really great groups in North Carolina, and I'm happy to get my card to you so you can talk with them.
Hi, I'm Jennifer Singh from Georgia Tech, and thank you so much for your sharing of information. I have lots of different questions. I'm curious how you recruit families or folks to be part of this. I'm sure that's not an easy process. Is this in different languages? So are you conducting Spanish focus groups? And I'm really curious about the process that occurs between the scientist and the folks that are setting these agendas. Has this actually happened, and are you documenting this process? Because I think it's really important.
So let me take your questions in order, okay? And the first question, remind me again, was about...
in terms of the recruitment, the recruitment process.
So we are very lucky that we have really great relationships with the executive directors and the program officers at Black Infant Health and Homeless Prenatal. Martha Ryan was a mentor of mine. So their staff actually enrolled and recruited women and invited them to come participate. In terms of documenting our process, we actually have a documentary filmmaker who is following us around to really be able, just the whole initiative, right? When you get a $100 million gift from rich people, you have to be very transparent, right? Right. So we decided that we wanted to bring in a documentary filmmaker so that we wouldn't just be funding our friends, right? One of the other things we did to answer your other question about what it is like to have community members with scientists in the room, it's very humbling to make everybody go through the same research training, research critique, and what criteria we're going to use to be able to evaluate proposals in the same room. You would think that people would be intimidated and people would be overwhelmed, but because most scientists actually don't get formal training on critiquing proposals, and nobody wants to admit that, but we don't. What we ended up doing was having them co-learn together. But we did a lot of foundational work with each of the groups separately so that there would not be this overshadowing and this over-talking. Make sense?
And in terms of Spanish?
Oh, Spanish. We're going to be working with the California Latinas for Reproductive Justice and one of my really good friends, Anu Gomez from UC Berkeley, to be able to do our work in Fresno in Spanish. But I will tell you, the Bay Area right now is really weird because of tech, and so we have this huge gentrification and flight of people of color out of the cities getting pushed out more and more. So that's a whole other piece that we're hoping to be able to expand our work around, because we don't want, economic injustice and economic, inequity to be the thing that continues to contribute to prematurity, even if we can fix it in a particular geographic location. Make sense?
Hi.